So the current state of art in Ph-positive ALL has also rapidly changed. Again, because of highly effective therapies, we're able to get more patients into a complete molecular response. And we do see in studies, largely retrospective, looks that if we have a patient that is in a complete molecular remission, when we apply transplant, there does not seem to be benefit. And in fact, we now are able to take patients and give them what we call chemotherapy-free remission drugs, such as a combination of blinatumomab and a tyrosine kinase inhibitor, a second or third generation tyrosine kinase inhibitor, such as dasatinib and ponatinib, and combining that with an agent like blinatumomab. Not only are we no longer having to use cytotoxic chemotherapy, but we also are not having to use transplant to give durable remissions and really equivalent survival to transplant. Again, though, that is if we are able to have access to second and third line tyrosine kinase inhibitors, if we are able to have access to methods to accurately measure measurable residual disease so that we can appropriately say who should not get transplant. But it is true that more and more data nicely shows that there's a large proportion of patients with Ph-positive ALL that no longer need transplant. This is a group, notably, that historically was the poster child for transplanting in ALL. And so I think it nicely shows the improvements that we've made over time in this disease. I think there are still subsets of Ph-positive ALL that do warrant transplant. Those are high-risk subsets, such as those with the IKZF1 mutations. Those patients should be considered for transplant. Still, patients who present with a very high white count in studies have been shown to still have a high risk for relapse. So there are subsets that we should still consider for transplant. And the upcoming GRAFT 2024 trial, which is a prospective trial randomizing patients who have persistent molecular positivity to transplant, will be highly informative to see how we do overall with this disease.